I'm here with Dr. Jace Wolfe, who's participating at our conference in Phoenix, and I have a few questions that I would like to ask you.
Great.
So the first one is, can you tell us a little bit about your background and why you're collaborating with Phonak?
Well, I'm an audiologist. I've been an audiologist for 17 years. Now I'm the director of audiology at Hearts for Hearing in Oklahoma City. Hearts for Hearing is a nonprofit foundation, and we work with patients of all ages. We work with children who are newly diagnosed with hearing loss, children with all degrees of hearing loss, those who do marvelously well with hearing aids, and those who eventually receive cochlear implants. We also work with adults of all ages and all technologies. So we have adult patients who use the Phonak Lyric device. We have adult patients who do exceptionally well with Phonak hearing aid technology. And then we also have adults who are cochlear implant recipients as well. I have also adjunct faculty positions at the University of Oklahoma and at Salus University in Pennsylvania in their audiology doctoral programs.
Can you tell us a little bit about your current role and what it is that you're doing?
I collaborate with Phonak for a couple of different reasons. When I first started out in audiology 17 years ago, I had two really diverse roles at the University of Oklahoma. One was that I oversaw a contract that the university had with the Oklahoma City Public Schools to take care of children with hearing loss in the Oklahoma City Public Schools to provide the audiology services. And then another is that I served as a contract audiologist at the VA Medical Center, taking care of veterans, typically an elderly population. And what I saw in both of those very divergent groups was that Phonak technology usually allowed me to meet those patients' needs more effectively than the technologies from other manufacturers. Particularly in the educational sector with remote mic technology, even that was available 17 years ago, but especially that's available now, without a doubt it was a leader in the industry. But now, fast forwarding almost 20 years later, I spend part of my time every week in the clinic, seeing patients clinically, and then I also spend a good portion of my time conducting and overseeing clinical research as well. And Phonak is very innovative in the development of new technologies, and most of my work is very clinical in nature, design. We will use a technology like sound recover, nonlinear frequency compression, or Roger technology, or anything in the high band products with Duophone or those types of technologies. And we'll have the question, does this really work for patients? And if so, how much benefit would we expect? And how can we optimize these technologies to really provide the best hearing performance that we can achieve with our patients who are using Phonak products? So that's where I really began another layer of collaboration with Phonak. I'd worked with Phonak for almost two decades clinically, but over the last 5 years, I've had a really intensive relationship conducting clinical research, exploring the benefits and virtues of Phonak technology.
Okay, so can you share with us some recent finding that you think we will find really
Sure.
interesting?
Do you mind if I don't stop at one, if that's okay?
That's fine.
We, over the past few months, have evaluated noise management technologies and hearing aids for children. And we've known for years that children really struggle to communicate and hear well in the presence of background noise. But what we have learned more recently when we've studied it formally is that children have a really strong preference for the use of Phonak noise management technologies in real-world situations, like in a car or the lunchroom or cafeteria at school, in their classrooms at school. We formally evaluated whether children preferred conventional technology or whether they wanted the Phonak digital noise reduction and the adaptive directional microphone system enabled. And children had an overwhelming preference for the use of these technologies, which coincides really nicely with the testing we did in the lab, where they showed considerable improvement with their hearing performance, their speech understanding, and noise with the use of these technologies. Fairly recently, we've studied the Duophone technology, the Phonak Duophone technology, both with children with hearing aids and also with cochlear implant users, advanced phonics cochlear implant users as well. And in both groups, we saw improvement in speech recognition over the telephone on the order of about 25 to 35 percentage points with Phonak Duophone technology, both for advanced Bionics cochlear implant users and for hearing aid users, which just blew me away. I did not think that binaural or bilateral hearing performance would be that much better with the use of Duophone compared to one ear alone, but our patients really love it, and it just makes sense that we saw that finding in the lab as well. And then finally, one thing that's most recent, the freshest finding that we have, we're looking at a new version of nonlinear frequency technology, a new version of Sound Recover. We were blown away 5 years ago when we evaluated Sound Recover in children with moderate hearing loss, and we saw improvements on the order of 20 percentage points in speech recognition, the ability to hear high-frequency speech sounds with Sound Recover compared to conventional amplification. And I thought, we've hit a ceiling. We can't do any better than that. But what we've learned is with a new form of Sound Recover that should be clinically available in the near future, children and adults both hear even better. And in many cases, 5, 10, 15 percentage points better than they hear even with Sound Recover 1. So that's the great thing. Just when you think that it can't get any better, Phonak's able to take another step with innovation, with development, with hearing performance.